Assalamu alaikum, welcome to CaliforniaCare. Today I wanted to talk a little bit about what kind of tips to use for your acid etch as well as for your composite, flowable composite particularly. This is where I get my syringe tips from: bent needle tips, lower log dispensing disposable tips. I would like to use this blue one, which here is right there, blue bent 25 gauge for my acid etch. So 25 gauge blue one, it's transparent, almost see-through, and it is good enough for the acid etch as you see it flowing through, and it's thin enough to not express too much acid etch out onto the tooth structure, and you can place it precisely wherever you want. When it comes to this flowable composites, you want to use a black one with a gauge of 20 gauge. 20 gauge is wider than 25 gauge. 25 gauge is thinner, 20 gauge is wider. It allows for right amount of composite to flow through. If you use this blue one, there are two negative things that happen. First of all, the lumen of the blue one is too thin compared to the black one, and this would take a lot of pressure for the composite to be squeezed out, and you don't get the proper flow. That has been my experience. But when it comes to this black one, which is 20 gauge, it's great because it flows right through and it comes out in the right consistency without too much pressure being applied to the back of the syringe of the composite, flowable composite. Second of all, it is very important to use the black tip to make sure that as it is sitting in the room, the composite inside does not get exposed to the light, hence it doesn't get cured. If you use the blue one, which is transparent, or any other transparent tip, the composite will get cured inside within a few minutes and it would not flow. So here is a recommendation again, come back to it, use black one 20 gauge for any flowable composite, and use blue one 25 gauge for using the acid etch. Hope that helps.